Chemotherapy has been used to treat cancer cells for over 50 years, but they are resisting the fatal conditions of this treatment. Cancer is known to grow at an abnormal pace without undergoing apoptosis. Cancer cells are mutations that proliferate, which affects the functions of cells in the organism's body. Chemotherapy is known to kill off and damage the replicating DNA of cancer cells. It also kills healthy cells, which in return gives cancer the advantage of resisting the body's immune system. Cancer cells that responded in the beginning eventually become immune.
Leukemia is a malignant cancer where the bone marrow and other blood-forming organs produce an excessive amount of leukocytes. It is known as the most common childhood cancer. When looking at the rate of survival for leukemia patients who have relapsed, the outlook is disheartening. Approximately 70 to 80% of patients who have relapsed result in death. Some researchers state that the cause of such a depressing percentage in the survival rate is due to the leukemia cells becoming resistant to the chemotherapy treatments.
Chemotherapy is known to be a good treatment for those with leukemia, but it is causing more problems than solutions. According to a study conducted by the chair of St. Jude Children's Research Hospital, children getting chemotherapy are known to become resistant and relapse a few months after treatment, and even during treatment. Over half of the children were known to have the most relapse-specific mutations in the 12 drug-resistant genes. This study contained 103 ALL patients who relapsed, and 20% of them tested positive for having treatment-related mutations at relapse. It revealed thiopurines could be one of the causes of these mutations, leading to drug resistance.
In this specific study, the timeline of relapse and resulting mutations from drugs both gave insight into the cause. According to St. Jude Children's Research Hospital, 55% of patients relapsed 9 to 36 months after diagnosis, but before treatment ended. To explain the relapse, some investigators have indicated that the cells present during diagnosis got treatment-related mutations, which divide and ultimately cause relapse. Dr. June Yang explained that drug resistance is not a foregone